Here, I shall be talking and continuing on food therapy. But today's topic is titled Sexual Dysfunction. Sexual dysfunction could be described as medical or social lesions. Yeah, why I call it social lesions is that, you know, it could break down the morale of both male and female, especially in these contemporary times. The value system and the norms is that you must be able to satisfy sexually your male or female partners. However, most sexual dysfunction is almost always or all the time ascribed to men alone. That is not true. I'm here to give you tutorials about sexual dysfunctions, its social negative effects, and food therapy that can be tailored to address these problems. Yes, some people have committed suicide because of inability to satisfy their wives or inability to conceive. Yes, so it's also a social problem, a social lesion. Now that we have the opportunity to address this menace, this problem that could be a time bomb if not wisely addressed. First of all, sexual lesions or low potency in both male and female. When I say low potency in both male and female, I know what I'm talking about. There are some men, a lot of men in our societies do not easily obtain full erection. A lot of men experience weak erection or no erection at all. Whilst a lot of women experience dryness, young women, sexually active women. When I say sexually active, from puberty to 45, you will see young girls at the age of 30, 30 something, 40s, they are so very dry. That is a signal of what? Of poor erectile functions in the body of male and females. Yes. You see, I shall be concentrating on the aspect of male low potency, otherwise known as weak erection or no erection. There are so many causative factors for both male and female. Factors like one, heart-related diseases, infections, and hormonal imbalances. It could even be due to maybe chromosomal abnormalities, a form of genetic problems. Yes, but that is so very rare. The most common sexual dysfunction or causative factor that induce sexual dysfunction is infections, hormonal imbalances, and heart-related problems. What are heart problems? For instance, raised fluctuated blood pressure, either hypertension or hypotension. That is either low blood pressure or high blood pressure. Yes, these are heart problems. Again, diabetes is also a heart problem. Atherosclerosis, rheumatic heart disease, heart failures, and many more. These are heart problems that could induce low erection or have low stimulus in the female. Once there is fluctuation in blood pressure, what it means is that Blood is not well pumped by the heart to the sexual organs. For individual to have full erection, there's supposed to be a complete blood flow directed to the penile region. Yes, because sex could be due to, erection could be due to passive feelings, not to even touching. Once you like individual, without even touching the person, you could be having erection or a woman being wet. When such is not experienced well, there is sexual dysfunction. So sexual dysfunction is not only restricted to men. A lot of women experience it more than men, but they are not so aware. Yes, and that of women could lead to one, delay ovulatory phase. What I mean is that it could lead to delays of release of egg. And when egg is not released, the woman will not take in. And that of male, it could lead to one, poor release of sperm. Yes. Sexual dysfunction, when I mean poor release, there are some persons who, once they just go into a woman in a few seconds, released. And if they are not able to get up again, it's ascribed as sexual dysfunction. Yes. Yes, because the penile organ may not be able to get up again. And then when a man is excessively too delayed in releasing, it could also be ascribed as sexual dysfunction. Yes. So what I'm trying to say is that both blood pressure, either hypertension or hypotension, can induce sexual dysfunction, can induce low potency in the male, and lack of stimulation in female. Then, and that of woman, and it could induce lack of stimulation, the woman not being wet. Diabetes also induce low potency in males and lack of stimulation in female. And all borderline lesions. What I mean borderline? You are not diabetes, you are not hypertensive, but you are trying to be diabetic or you are trying to be hypertensive. So when we say borderline lesions or borderline diseases, what we mean is their nearness to a disease condition can also lead to sexual dysfunctions. And again, what we eat do also contribute to sexual dysfunction. Yes. What we eat also can contribute to sexual dysfunction, especially when we eat food that contain high level of cholesterol, food that contain much fat, could lead to sexual dysfunction. Yes. Then other lesions that are implicated could be rheumatic heart disease, heart failure, infections, sexually transmitted diseases. A lot of people, always one time or the other and are infected through their sex partners. And if that is not treated properly, it could induce sexual dysfunction. It could induce weak erections and low stimulation in a woman, which would be very bad. And as such, some people could easily lose appetite in sex. So sexual dysfunction is not only for male individuals alone. If a woman doesn't wet easily, it's due to sexual dysfunction. Yes, and such persons most times experience what difficulty in what in taking in or being pregnant. Yes, always experience such. And again, administration of certain hormonal drugs, abortic drugs, or people who often go for dilatation and curatives, that is DNC and all that, who also indirectly induce to themselves sexual dysfunction, you know, having lower hormonal secretion and all that. And because most of these hormones are implicated in sexual functions, like FSH, follicle stimulating hormone, estrogen, female hormone, androgen, male hormone, and all other hormones play a major role in sexual functions. So if the parameters of all these hormones are lowered, such individual could have problem in sexual functions. These are the foods directed to treat such lesions. But first of all, the causative factors that induce sexual dysfunction must be isolated. What I mean must be isolated, must be treated. Yes, must be treated properly. If it was due to infections, such person must treat himself with antibiotics or certain food intakes that have antibiotic properties. There are foods that have antibiotics properties and that can treat infections. Like I always say, all food are drugs, but not all drugs are foods. Yes, then if it is due to hormonal imbalances, we will address it with foods because it also can be addressed with drugs. But today I'm not having a content on social media about drug therapy. I'm having a content on social media about food therapy. So we are going to use food. I'm going to talk about food to address sexual dysfunctions. Most foods that are used for infertility also help in potency, also help in what? Sexual functions. Yes. Some of the commonest food, one, banana, watermelon, walnuts, tomatoes, raw tomatoes, and many more. Yes, banana, especially for female, when you take banana with walnut, tomatoes, and soya milk, like vitamin, vitamin is soya milk. You can make it as salad and take. It gives a kind of, it relaxes the heart, allow the heart to pump blood very well to the sexual organs. So a such person will easily wet, such female will easily wet. If it is a man, such man will have an libido, high libido, yes. And also, watermelon act as a Viagra. Watermelon allows the blood vessels to pump blood to the sexual organs, like the penis and the female organs. Yes. Once you eat watermelon, give yourself 1 to 2 hours. Such person will attain potency, will attain high erections and all that. So watermelon is one of the basic food to address sexual dysfunction. Again, foods like onions, garlic, grate it and mix with honey or lemon. If the individual is diabetes, you should mix with lemon and take it at least and wait for 2.5 hours. But if the individual is not diabetes, he can mix it with honey, then wait for 2.5 hours before sexual intercourse for both male and female. So I'm not just talking about male alone, because the common belief is that sexual dysfunction is only ascribed to male. Yes, females suffer it most, but they are not aware. A lot of young females have dryness in their vaginas. A normal physiological female is supposed to be is supposed to wet easily. A woman that wet easily, taking easily. Yes. If you do not if you don't wet easily, you don't easily take in because egg is not always released as at when due. Yes. Sexual dysfunction affect even the ovary because ovaries that produce egg. Yes. So another potent food for erectile purposes or for both male and female is banana with alligator pepper. Alligator seeds, they'll put about 5 to 8 seeds, put it inside the vagina, inside the banana, yes. I'm talking about banana and alligator pepper. Put the seed inside the banana, eat the banana and ground the seed inside the the banana. That's the alligator seed inside the banana. You press inside the banana. Yes. Once you eat it, wait for 1 or 2 hours. Such individual, whether male or female, will experience high libido. Yes. The advantages of this is that alligator pepper increases sperm cells and make a woman to release egg easily. Yet it also maintain blood pressure because allow blood to flow to the penile region or to the sexual organs. Yes, so that once there's a normal flow of blood to the sexual organs, such individual will always have a beautiful sexual intercourse. Yes, the food that can help us are all within us. Walnut is another potent food for potency, for penile erections, and for female sexual functions. Yes, we're not. They are very numerous. They are very numerous. But today, as I'll be talking about few, but know that there are foods that can always help us to address this problem. And dependent on drugs, especially male individual for penile erection could have a lot of adverse effects. Don't be surprised at 50s if you are somebody who depend on drug for erectile functions and all that. Once you attain 50, you see there'll be complete death of erectile function or weakness of erectile functions. So you don't necessarily stress the penile muscles, yes, or stress the heart with synthetic drugs, synthetic animals. I don't advise people to take the drugs for stimulations. Yeah, because when you do that, yes, you have the immediate benefits, but on the long term effects, it's going to be devastating. Yes. So this is my topic for today: sexual dysfunctions and how it can be addressed. Thank you very much for listening. Yes, thank you.